Yes, ma'am.
Good morning, ma'am. Good morning, class. We are the student of Station 4 and we are going to present our module on the topic first aid for burn. So firstly, what is burn? Burn is an injury or damage to the skin or other body tissues caused by electricity, heat, flame burn or chemicals. Now I will explain the types of burn. First degree burn affects the outer layer of the skin. Its symptoms may look like redness, swelling and pain. Heals in a few days. Next. Second degree burns affect outer layer and part of the inner layer. Its symptoms may look like blisters, redness, pain and swelling. Heals in a 1 to 3 weeks. Now the last one is third degree burn. We can take the example of Tommy, in which nerves were damaged, painless and no sensation. And the skin may looks like white, brown and required for medical treatment. Now Tanak will continue and she will explain first aid management.
Now I will explain about the first aid management in burn. Firstly, before entering the burn space, the fire place, we have to put a wet towel around our face to protect ourselves from the gases, harmful gases, which is released from the fire. After that, we have to remove the victim from the fireplace and lay them down on the ground and wrap them in a blanket to prevent the fire. After that, we have to pour running tap water for 10 to 20 minutes in the burn place and clean that place and put clean and sterile cloth in that place. If the burn is superficial or first degree, we have to apply silver sulfatizing ointment in that place. Avoid using any kind of home remedy like oil, ghee or anything or any kind of other kind of ointment. It can uh, it can infect more the burn, and if the burn is large and deep, seek the patient to the hospital immediately. Thank you.
Place is for first aid for chemical burn.
Chemical fall in my hand. Please help me.
Don't panic, I will help you. First up, console yourself. We don't touch the chemical area, and secondly, move away the patient from chemical sources. Carefully remove the contaminated clothes, watch and accessory jewelry. Wash the hands with clean running water for 20 to 30 minutes. Do not apply the toothpaste, oil and butter for the malaria. Cover the burn area with clean and sterile clothes. Transport the patient to the nearest hospital for immediate medical care.
Now we'll see the electrical burn management. Excuse me, what happened? Water. रुको, उसे पानी नहीं देना है और डायरेक्टली टच भी नहीं करना है. First of all, we have to check the electricity source that it is on or off. If it is still on, then we have to stop it. We have to switch it off. And for our own protection, we have to use insulating materials like wooden stick, rubber sole shoes, and folded newspaper. Secondly, we have to remove the patient from the electric source, and we have to check the responsiveness of patient. In checking a person's response, firstly, lie them in a comfortable position and check the airway. Second, check breathing, and if there is any pulse sensation, then keep the patient in lateral lying position and check for salivation. If there is no pulse sensation,
Then keep the patient in a comfortable lying position and then provide them CPR. Then if the patient is in shock, then we have to minimize the shock. As for minimizing the shock, keep the patient in a comfortable lying position, keep a blanket around them and wrap them to minimize the shock. And then the next step is treat the burnt area. Cover the burnt area with a sterile gauze piece or any piece of cloth so that it will not affect further. And then the last step, send the patient to the hospital for the further medical help.
करना चाहिए और क्या नहीं करना चाहिए.
First, we will ensure our safety. What we see what to do. First off, move away the patient from the burn area. Hold under running water for 20 to 30 minutes. Cover the clean clothes close to the burn area for prevent infection and transfer the patient to the nearest hospital for immediate care.
हमें क्या नहीं करना चाहिए? टू नॉट अप्लाई बटर और टूथपेस्ट. हमें कभी भी जले हुए खाओ या जले हुए जब टूटे हमें टूथपेस्ट या बटर नहीं लगाना चाहिए. डू नॉट ब्रेक क्रिस्टल, दे कीप द वुंड्स. क्रिस्टल को फोड़ना नहीं चाहिए